Drohan. I'm a scientist at Volpara Health, and I'm here with you today to talk about our comprehensive risk assessment solution known as Risk Pathways. So, despite the tremendous benefits of screening mammography and reducing the burden of breast cancer, we still have a long way to go. Right? Our current protocols for age-based screening, in fact, leave many women behind. Interval breast cancers continue to be a problem, and many who are at high risk are in fact younger than 40 years old and don't qualify for screening. It's been shown that adding supplemental imaging for high-risk patients can increase the cancer detection rate in women's imaging, which is leading us in a shift away from age-based screening towards risk-based screening. And now this is something that all the major medical societies are talking about and are coalescing around recommendations for additional imaging and screening for patients who are at high risk of breast cancer. Now, our collaborators do a great job at showing us that personalized screening can work. So here we show how two different centers, one big, one small, have both found ways to raise the standard of care at their centers by not only finding cancers that might well have been missed, but also highlighting how these programs can be made self-sufficient in their revenue requirements. So Volpara Risk Pathways is a comprehensive breast risk assessment solution that is optimized to support women's imaging workflows. Right? It's built on a series of components that focus on patient engagement, IT integration, and effective risk and decision support communication. So this technology and program solution is really part of our broader breast health platform that's transforming imaging centers around the U.S. and abroad. Right? And understanding how risk assessment fits into the mammography workflow is certainly a core strength of the Volpara team. So cancer care is inherently a multidisciplinary activity, and we are committed to building technology that pulls team members together. Right? We recognize the many different roles that are touched by a comprehensive program, and we believe in our power of our technology to be a force multiplier for their efforts in sharing in the care of their patients. Now, of course, a good risk assessment program is really more than just a score. So when building one of these programs, here are three key elements that you should consider. First, really establish your goals, and by doing so, understand the high-risk interventions that your program supports. Right? And second, understand that many high-risk interventions involve shared decision-making with the patient, and that how you communicate that risk is going to become critical. Third, leverage the existing IT infrastructure and technology to support the program efficiently. So when you look at this operationally, it really does start with what we call our patient profile builder. Right? Now this is where we take a survey to collect the information about the patient's family history and past medical history in a way that aligns with the objectives of your screening program, with customized content and branching logic that allows patients to move efficiently through the process and to really curate the information over time. Next, we talk about our risk engine, where we have all of the latest up-to-date models and guidelines. This is a big part of how we automate the process and really help you focus more on what you want as a clinician to support for high-risk interventions and less about the intricacies of individual risk models. Next, we talk about our care pathways, where we really integrate the clinical decision support and the high-risk management recommendations into the mammography report, PCP letters, patient letters, and other risk communication mechanisms. Now, within that module of care pathways, we also talk about monitoring, tracking, and managing the high-risk patient population. Right? So this is a big part of how we improve patient outcomes and increase our compliance rate with high-risk interventions. Of course, when you understand program performance by monitoring structured data, not only do we get a view of the population overall, but we can start to build support for these programs within an institution. So thank you very much for joining me today on our discussion, and hopefully we've piqued your curiosity on Volpara's new risk assessment solution called Risk